like I think it's important for all of us, and I think that's one of the health habits that many of us are the most maybe negligent about. Also, and as Adventists, sort of we haven't been very good on sleep. It's sort of also in our work culture. I don't know how many of you work in the church, but sort of being tired, working hard, working late. There's so many bad things that are said that are not conducive to healthy sleep life in the way we communicate about the value or the lack of value of sleep. So that's it's an important thing, and also when especially like young people, also teenagers, students, many of them, I think the way they manage their sleep is not good. So it's an important topic.
One observation I've also made around sleep is that we say, well, in order for me to get my 8 hours of sleep, I have to work 16 hours. So we work 16 hours in order to get 8 hours sleep, and we don't take downtime in between.
Oh. Well, I have a friend. He's sort of a bit neurotic, and he agrees it's a bit sort of OCD, and he was freaked out completely after hearing me talk about sleep some years ago. So he started like putting more like his day started when he went to sleep. So he would be all stressed if he was losing 1 hour in the evening. Then he would be all stressed. The next day would be ruined because he felt he hadn't gotten the 8 hours. But that one of if we were really sensible, we would not put an alarm in the morning. We would put an alarm in the evening when we were supposed to go to bed. This is when, like, by this time, go to bed. And it's not just that we need 8 hours of time in bed, we need 8 hours of sleep. And it's very interesting. I've started using a watch that's doing sleep tracking, and that's interesting to see what kind of numbers and data that generates. So that can be a way to hold oneself accountable also. Yeah. So yeah. But shall I continue with mental health in general? I must say I'm so fascinated by seeing so many people in one room without masks. That sort of I don't know if I would have dared to be with you. So here everyone, like I was a couple of weeks ago, I went out like an errand, and I walked into one of these sort of home improvement stores that we have here in the US, and people looked at me strangely, like I felt like, what's wrong? And then I realized I was walking without a mask. And I sort of felt also like the kind of nightmare where you feel that you're naked or something in public. That's how it felt here to be without a mask. So I don't know when we'll be able on this side to be able to feel comfortable without masks. So, but I'm happy you can you deserve it. You've done a very good job managing COVID-19. So, but still, even though you've managed the infection issues quite well, you still have issues with the mental health aspects of COVID. And what we can say, sort of in short, that this pandemic is basically sort of turbocharged the mental health issues in the population in general, and especially young people. It's a real challenge. Many people are struggling. This is just the world data from today. 2.5 million people around the world have died because of COVID-19. These are people who could have been alive if it had not been because of COVID-19. Over 100 million cases of COVID-19. Fortunately, I don't know how many cases you've had. Norway, we've had, I think, about 600 deaths because of COVID-19. Sweden, which is our neighbor country, has and have 20 times that number. Their population is about 50% more than our population. So huge differences in the countries. And what's interesting here is the young generation that is growing up, that is entering into adulthood in the midst of a pandemic, a global crisis as the one we have faced. How does that impact their thinking, their perception of the future, their perception of themselves, their perception of relationships? There's so many things in this that will be very interesting to observe and work with in the future, and will be interesting to see. Antonio Guterres, United Nations Secretary General, he said that the COVID-19 pandemic is the most challenging crisis we have faced since World War II, and that's not just a public health challenge, but it's also the mental health challenge, which of course is part of the public health challenge. But it's been, I think, like the United Nations World Health Organization has really done a good job in acknowledging and emphasizing the mental health impact also as much almost of a concern as the people being infected by the virus itself. An interesting study that was done last year in the UK, it showed that people were more concerned about the mental health impacts of COVID-19 than they were of catching the virus and getting ill with COVID-19. I'd like to just show this short clip by Antonio Guterres when they launched the initiative in May last year. Feels like a very long time ago, but it's still very relevant, what he said about the pandemic and the mental health impact. And also just like notice, this is not the World Health Organization. This is brought to the highest level. That's how important it is considered by the United Nations. So this is like highest level where it is presented.
Mental health is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate in our communities. But the COVID-19 virus is not only attacking our physical health, it is also increasing psychological suffering. Grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. Throughout my life and in my own family, I've been close to doctors and psychiatrists treating these conditions. As Prime Minister of my country, Portugal, and as High Commissioner for Refugees, I became acutely aware of the suffering they cause. And this suffering is often exacerbated by stigma and discrimination, what is absolutely unacceptable. After decades of neglect and underinvestment in mental health services, the COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them. Even when the pandemic is brought under control, grief, anxiety, and depression will continue to affect people and communities. This is the background to the policy brief on COVID-19 and mental health that we are launching today. Mental health services are an essential part of all government responses to COVID-19. They must be expanded and fully funded. Policies must support and care for those affected by mental health conditions and protect their human rights and dignity. Lockdowns and quarantines must not discriminate against those with poor mental health. As we recover from the pandemic, we must shift more mental health services to the community and make sure mental health is included in universal health coverage. the United Nations is strongly committed to creating a world in which everyone, everywhere, has someone to turn to for psychological support. I urge governments, civil society, health authorities and others to come together urgently to address the mental health dimension of this pandemic. And I call on governments in particular to announce ambitious commitments on mental health at the upcoming World Health Assembly.
This was a quite strong
Mental health is at the
appeal
core of our humanity.
from the top level of the United Nations. And what I think is very important to recognize that what everyone is saying is that even when we get the pandemic, COVID-19 pandemic itself under control, hopefully in a few months, the mental health impact of this pandemic is going to stay with us for years to come. And that is something that we will be dealing with. And I'm curious, would also be interested to hear sort of to what, when you are working with young people, how you experience that, how much, what it looks like for you, what feedback you have gotten on it. COVID-19 is much more than just a physical illness. It affects all dimensions of life, what we are, the biological, psychological, social, and also the spiritual aspects of it. I just like put up sort of what has changed because of this pandemic. And this is not, I'm just trying to compile some things. It's not an exhaustive list, but we know lots of people have died. Access to healthcare, many places have been reduced because of restrictions. People haven't been as physically active. Lots of people spend time at home, indoors. Sleep, time to rest. How is that affected? How do people eat? That can be both ways, better or worse. The mental health aspects, media consumption, screen time for many is significantly up. We know depression, anxiety, stress, trauma disorders, and substance abuse, and also indication on suicide. Like the numbers are not quite clear on suicide, actually. Sort of, it's a bit sort of, we're getting information both ways on how it's actually affected on suicide, but we know sort of that definitely other mental illnesses are up. So that's very interesting to analyze what's happened in regard to suicide. Travel, working from home, people have kids at home, closeness to others, face interactions is down. Loneliness, huge problem. Domestic violence is up. And then what we can call existential spiritual health, hopelessness, sense of meaninglessness, plans for the future. People struggle with that, monotony, and then more directly with God. How has that affected people's connection with God? Trust in God can go both ways, and I think people have various kinds of experiences on that. I tried to look for some research from Australia here on the mental health impact of the pandemic, and I'm not sure if I found the most relevant or best studies, but I found this one at least in my quick search. And this is sort of a status what they found. It was published. Let me see, when was that? It was I think about the middle of last year, sometime. So this self-reported study, 78% of respondents, and was a big number, I think it was about 5,000 participants in this study. 78% of respondents, adults in general, not specifically young adults, they didn't see that they differentiated on age. 78% said that their mental health had worsened since the outbreak. 1/4 were very or extremely worried about contracting COVID-19. Twice the number here was worried about the family or friends contracting COVID-19. That's what we see in other places also. People worry often more about others than about themselves. Uncertainty, loneliness, financial worries were common. More people responding elevated depression, anxiety, stress, health anxiety, quite understandably. And of course, people who were already struggling with mental health issues, they were struggling more, as would be expected from this. It was just one Australian study. We had a major study done by the CDC, Center of Disease Control and Prevention in the US, was published in August last year, US population. Also a self-report study, but they do these every year, so the numbers are relevant and comparable to other years, and found that 40% of the US adults were reporting struggling with mental health or substance use, and significantly higher numbers than before. What we found here was that anxiety, people who were reporting struggling with anxiety were up 3 times compared to 2019, a tripling of people self-reporting having symptoms on the level that would indicate that they may be struggling with an anxiety disorder. That's a dramatic increase. Depression, even more, 4-time increase compared to 2019. And it's sort of evident just like this must have major consequences for people on several levels. Then people thinking about suicide was more than doubling of people who had seriously considered suicide in the last 30 days. 10%, more than 10% of the population that was surveyed had seriously considered suicide in the last 30 days. These are the overall numbers. And then they broke them down on various vulnerable groups. And that's where it gets even more alarming. On the ones reporting mental health or behavioral health system that includes substance use, significantly struggling with that in the age group 18 to 24, 3 in 4 were reporting struggling significantly with these issues. So that's you can see the other numbers. The age group 24 to 44, 50%, and then it drops as people get older. It drops further. I don't think they surveyed people who were younger than 18. And then on suicide, in the age group 18 to 24, 25%, 1 in 4, had seriously considered suicide in the last 30 days. And this, again, it just shows like that this young age group are struggling significantly more in general than older people. And that's why we need specifically to pay attention to the mental health challenges of young people. American Psychological Association, they published a report in October last year. And this is the link to it if you want. It's interesting to read. And again, sort of these things may be somewhat different in your country, but still the trends are similar. The numbers may not be exactly the same, but we see from around the world, the reports coming in are the same trends, that young people are struggling significantly because of this pandemic. Let me see. I think I clicked the link. I'll find the presentation again. So I go back to it. I clicked out of the presentation, I think there. There we are. So here, this is about Americans, but again, I think it is relevant also would be relevant for comparison in your territory. Americans have been profoundly affected by the COVID-19 pandemic, and the external factors Americans have listed in previous years as significant sources of stress remain present and problematic. So COVID-19 issues, they of course, they come on top of what people already were struggling with and were stressed by. These compounding stressors are having real consequences on our minds and bodies. It is the unusual combination of these factors and the persistent drumbeat of a crisis that shows no sign of abating. Fortunately, now finally, numbers are going down, but they said this is leading the American Psychological Association to sound the alarm. And when an organization like this sounds an alarm, then it is serious. They say we are facing a national mental health crisis that could yield serious health and social consequences for years to come. Again, the same message. The mental health impact of this pandemic is going to stay with us for years to come. Then they say, and again, I will focus now on the younger, because that's also what came out in this report, especially what they call the Gen Z group population. They're struggling disproportionately much compared to the others. The potential long-term consequences of persistent stress and trauma created by the pandemic are particularly serious for our country's youngest individuals, known as Generation Z. Our 2020 survey shows that Gen Z teens and Gen Z adults, they say Gen Z teens 13 to 17, adults 18 to 23, are facing unprecedented uncertainty and are experiencing elevated stress and are already reporting symptoms of depression. I think this uncertainty about the future, that comes out very strongly. And I think for me, it's quite a while since I was in that age group. I've lived a couple of decades as an adult, have lots of experience with what the world is like in more stable times. I think what is interesting and what's maybe easy to overlook is that the young generation growing up today, they are in many ways growing up, at least in a world that is more uncertain and more unstable than the one I grew up in. When I was a teenager, we had the fall of communism in Europe. Things were looking bright. We're thinking that the future is like looking very good. I think for many of the young people now growing up, there are major concerns about the future. And that's what they say also in the study. Gen Z adults have largely grown up during times of disruption and unrest. And they say that the rise in suicide rates, which you have in the US, that's troubling. The last 20 years or so, 20 or 30 years, there's been 30% increase in suicide rates in the US. And that's troubling. What's going on here, and is troubling also, is this a trend that we will see in other parts of the world later on? Rise in suicide rates, widespread sexual harassment, assault reports, the Me Too, and change in abortion laws is a source of stress. We think also things like climate change, politics, those issues are also major issues for young people. Nearly 8 in 10 Gen Z adults say that the future of our nation is a significant source of stress in their life. Gen Z teens are struggling with uncertainty of their own futures as well. 50% says the pandemic has severely disrupted their plans for the future. 51% report that the coronavirus pandemic makes planning of their future feel impossible. When we think about this, they are about to embark on adulthood, entering into a world where they need to have expectations and plans for the future, but then they feel they cannot do that, cannot plan, don't know what to expect. then despair, hopelessness, anxiety is clearly something that many of them can struggle with. School issues that they also report. Yeah, and then for adults, again, pandemic has been a significant source of stress. Yeah, I think I'll just skip that. So then, what the question that we had, what may we look for? How do you know that something is up? This is, you can recommend that you like maybe that there's so many good resources online on these issues. If you have any questions about mental health issues, a Google search and looking at reputable organizations will give you a lot of good sources on this. This is from one of the US organizations, National Alliance for Mental Illness, or on mental illness. And they listed some of the things that can be indication. I think this list seems to be sort of both a self-assessment list, but also what you can watch for in others. So, for example, starting here, excessive worrying and fear, anxiety issues, feeling people, or you get the sense that their mood, feeling excessively sad or low, depression issues, people who are confused in their thinking, problems concentrating, learning, like behavioral issues. And I think that's often what we observe. Sort of, it can be difficult sometimes to sort of observe the actual emotions that people are struggling with. But sometimes you will see more the behavioral issues, and the younger people are, typically the more you have to rely on behavioral issues to understand what's going on. Because if you ask how they're feeling, they may not have the language for it, they may not have the reflection to actually be able to express what's going on, the self, like the insight and understanding of what's going on. But also mood changes, extreme mood changes, uncontrollable highs or feelings of euphoria, but in general, instability, significant instability of mood can also be an indication, irritability, anger. And then this one I think is very important, when you see a change in how people relate socially, then that's really a reason to consider and wonder what's going on. They start to withdraw from friends, from social activities. That could be a sign that they are struggling. People have difficulties relating to other people. It can be various issues that they're struggling with. Their sleeping habits, people feeling tired, young people feeling tired, low energy, that's something to consider. Eating issues, sex drive is also known well, maybe not what you will they will tell you about and be most relevant as such. People, if they struggle with how to understand reality, delusions, hallucinations, definitely something to be concerned about. Changes in emotion again. If you see that they are starting to use drugs, experiment with that, or in other ways also, like various kinds of reckless behavior, that can also be an indicator that something is going on. One issue that we often see in young people is that they can have physical reactions, that the mental symptoms are expressed more in physical symptoms, maybe than in emotional symptoms. So if they're complaining about physical pains, that kind of things, and if they are checked and you can't figure out that there's anything wrong in that sense, there's still something wrong. This is very real. But there may not be a physical cause of it. Again, reason to consider what's going on mentally. What's important is when people are thinking or expressing thoughts about not wanting to live anymore, maybe talking about thoughts about killing themselves. There's something, how a myth that people who talk about suicide, they don't commit suicide, but that is really a myth. Always take it seriously. If you get the sense that someone is about or considering giving up on life. And then in general, people struggle with how to function. And of course, eating disorder, body image issues is also common, or many people can have that. That's just like a list, many items here on this list. But what I would recommend, like in general, is like remembering all this and checking things on and off. The list may not be what you want, but like if you get the gut feeling, you get your intuition is telling you that you wonder if something is going on, then take that seriously and explore further with the people you're working with and for. If you find yourself that you're wondering what's going on, see if you can find an opportunity to talk with that person, or if you don't have that kind of relationship with the individual, then maybe you can work through others who can talk with a person. Or if the person doesn't want to talk with you, maybe ask, is there someone else you would like to talk with? Or also maybe make an attempt at a later point if the person is not willing or ready at the moment to talk with you. I would really strongly recommend that you read about these issues. Mental health issues are not really sort of that scary, but if you don't know much about them, it's easy to avoid going into it. But I would say, like my own experience having worked with these things, it's really interesting, it's fascinating, and it's very rewarding to come close to people who are struggling when they open up, when they share. It's not your job to fix them, it's not your job to solve their problems, but to be there and support, listen to them. Oftentimes I see that my job really is to listen, often like the patient, the person struggling, just by having someone to talk to, will be able to process things, work through things, figure out how they want to solve and work on things. So I just compiled some resources here that may be interesting for you, and I would recommend that you consider. We have, and I will just switch to my browser just to show you them. But we have just briefly like what we call the COVID-19 Mental Health Initiative, where we in the General Conference, we've done some things to put more focus on these issues, and that's what we consider, or we would recommend to you also, that you think through what you can do in your territory with the people you are working with. How can you support them? You may draw from some of the things that are there, and also do other things. In our work, we discovered that the North American Division Youth and Young Adult Ministries, they had just last year published a booklet series on mental health that is really good. And it's free. You can download it, you can distribute it, you can even print it, as long as you keep it in the original form. And we're also working with them as we want to see this is something that we could make more available also to others. Fortunately for you, this is in English, but also in other languages. I don't know if you're familiar with the Uncertainty Project. This is a project that is a collaboration between the Inter-European Division, the Trans-European Division, and also I think the South American Division, that they planned this project in 2019, dealing with uncertainty. How is it to live with uncertainty? And of course, they had no idea that COVID-19 was coming. But they have produced a lot of videos, content that is, I think, very, very good. And then mental health first aid guidelines from Australia. I don't know if you know this organization. It has grown and it's quite international today, but my understanding is that it originates from Australia. And they have guidelines on various kinds of mental health issues. PDFs, 3-4 pages, that is on like how can you help people and support people with these issues. And then we're working on developing a mental health resource that we'll call Reminded, that is going to be also globally available, and hopefully late this year or early next year we will have resources. I will show you one, just like to do some marketing for it. Just one of the animation videos. That this is very much based on also short videos. Let me see if I can now find, so I can show you the website. This is the Youth Alive page, where we have a page on mental health there for the COVID-19 mental health initiative. And we have just like a promotion video where we sort of present why are we doing this. And especially like we've compiled some things, already existing things that might be relevant, that might be interesting. But here especially this mental health series by the North American Division, and this is their website where they have these booklets. You can download them here. View them, and that is on anxiety, depression, suicide, self-harm, how to get help, these basic things. And it's designed for young people. I would say sort of basically anyone can benefit from it, but it's well done, really well done. And I would, if you haven't sort of done much or read much on mental health, this could be a very good place to start. To go through these booklets. You don't need that much time to read through each of them, and you can just download them. It is free. Then the Uncertainty Project here. This is the website. I think it's well, I can't see now the domain. It's uncertaintyproject.org, and here they have these various videos, what they call the series, short stories that I think are true stories, social media clips that you can share. This is a movie they created. I don't remember how long it is, but it's like a story about uncertain, like those issues, and documentary. So this is, and they are coming out with a book soon also on this. So check out these videos. It's well done. And then the mental health first aid guidelines are here, also for free. In the US, you have to pay for all this stuff, but your Australian, the headquarter, I think, of Mental Health First Aid Australia, they are offered for free. And they also have training in mental health first aid, where you can do it online. It costs a bit to be trained. That's also something I would recommend that you consider. So those are some places to go if you have questions, if you are wondering about things and want to learn more about it. And then if I may just show like a short video of like the first animation video on from the Reminded project. We are developing now on depression, anxiety, and trauma. Those are the topics that we will make available now in the first round, and we hope to release the whole program. That will be something that people can do individually online. I think it's an excellent way to train yourself on this, but also for people who are struggling. So our goal is that you can do it on an app, on the phone, on a website, but the various videos we are like doing animation videos on 6 videos on each topic, and we're also making a short film on each of them. And the short film for depression, that's about a girl, young college student struggling with depression. The trauma one, which is the next one we are producing, that's also female, and then the next one will be on anxiety also. So, but then I'll just show you the first animation. This is the on what is depression, just to give you a feel of what this, and we're working on now when as soon as these animation videos are ready, the 6 on depression are ready, we will release them also on the website, is reminded.org, and they will also be on YouTube, so people can watch them, and it's freely available.
What is depression? Depression means that something is pushed down. In depressive disorders, what is pushed down is our mood, interests, and energy. We may all feel sad and tired when bad things happen. That is normal. But depression is much more than that. In depression, we may feel sad, angry, and distressed about almost everything. Often, most of all, about ourselves, who we are, and life itself. We may lose interest in whatever used to give us joy and pleasure. We may feel exhausted and tired without having done anything. And even though we rest, we cannot recover strength and energy. Depression is a serious medical illness. It negatively affects how we think, feel, and act. It makes it difficult to work, love, and play. Depression is emotionally painful. Severe cases may be so painful that people give up on life. Depression is a leading cause of death by suicide. Many people everywhere around the world struggle with depression. Right now, almost 300 million people are suffering from some kind of depressive disorder. Depression affects all kinds of people, any gender, any age, any financial status, any race and ethnicity, any religion. Depression is so common that many of us will experience it at some point in life. All of us may know someone who is depressed, someone in our family, a friend, a neighbor, a colleague. Unfortunately, many suffer from depression without telling anyone, without getting any help, some even without knowing it. Fortunately, depression can be helped. There are things you can do to recover, and there are many treatment options. We explore these in Reminded.
So that's just one sort of example of what we will have. These kind of videos that are 2-3 minutes long. And this one is what is depression. The next one is what are the symptoms of depression, what causes depression, what's going on in the depressed brain, and then what can you do for yourself if you are depressed, and then treatment for depression. And so this is how we will cover that. I hope that can be something that can also, it's easily shareable and can be made available. Yeah.
Thank you so much for that, Torben. Once again, very insightful. I'm sure many of us have learned different things, and I'm sure many of us have questions. So if anyone wants to
comment.
Yes.
So obviously in Australia and Victoria, we've had 150 something days of lockdown during last year. And I think a lot what you talked about fits very well into that time. But at the moment we are out of that lockdown. We had just a 5-day lockdown last week. When was that? And when I work with teenagers, at the moment, because the COVID is kind of there but not there, because we're not wearing masks, we are getting to do some things normally. I find that they're living life extremely hard. So if they party hard. If they're trying to find a date, they're dating hard. Whatever they're doing, it's every day has to be lived to its full, and that has its good consequences, but also its bad consequences. And also, when we did go back to that 5-day lockdown, the mood and the depression, it came back so much faster. When the first time the resilience was there for a period of time, in this third lockdown now, within that 5 days, you would see that the kids who you were very concerned about during the first and second lockdown slump back to that very low very quickly. And that's just my comment on what's happening here.
I think that's sort of what you say, that they pursue life very intensely when they finally are free. I think that's only to be expected in a way. It's a very natural response, and that's sort of what's probably going to happen in many other places also. That can be, as you say, there can be good and bad things coming out of that. I don't know how we can prevent that. I think it's a natural thing, and people will respond differently from that. Some will engage in positive things, some will engage in not so positive things.
Anyone else?
I have a comment as well, that I'm going to go back to the focusing on sleep aspect. I've got 4 kids, 14, 13, 11 and 10. So even though I'm here Pathfinder Director level, I'm very interested in this personally in family life. We did homeschooling to start with, and then when we did start at school, I don't know, she was 12, I suppose, at the time. She started high school and she'd come home and we'd have tea and, all right, time for bed. Oh, but I've got homework. I said, too late for that. Got to go to bed. But I've got to do my homework. Do you want me to fail? And they're like, no, sleep is much more important than homework right now. And because I didn't take on her anxiety about it, I just said, doesn't matter, go to bed. She thought I didn't care. And I have leaned towards more activities, more life involvement, whatever, over the last few years. But I think I'm going to get back to the sleep is more important than most other things at the moment. So I really thank you for that.
Well, I think that sleep is foundational. It's sort of, if you don't get that one right, it's very difficult to get the other things right. So that's why it has to have top priority. And that's also in our own lives, what we do in our church life, whatever it is, also that we prioritize sleep. If we do that well, then we will work more efficiently, we will accomplish more, we will be much nicer to be around, there will be less conflicts, and all these. There are so many things that come so much easier if you get that one right. And that's basically many of the health habits. When I was in medical school, the times when I were having exams, that's when I was most regular with sleep and with exercise. because I just knew from experience, if I didn't do those two things well, I was not able to get things done that I needed to do. And sort of in between, when I had more time, then I would not be as faithful with exercise and sleep. I would still manage to do quite well until I started working as a doctor and got my sleep pattern completely messed up. So, but these things are just like, I think in life in general, like have to prioritize. Most important things is sleep, exercise, having time to eat, connecting socially, connecting with God, and then we can work. Like if we could like live that radically, I think we maybe would accomplish much more sometimes than we do when we get our priorities in the wrong order.
I had a question about what's the next step. If you know someone and the parents have come to you that their child is obviously depressed, withdrawn, not able to do anything, so that they need some help, what's the next thing to do? Refer them to a GP, or what's the next step?
Yeah, sort of that can sort of course, it depends about a bit on how your system is, but I assume if your system is somewhat what I'm used to, then like a GP would often be a first place to go. Another way, like a school counselor, if they have such a thing. Sometimes you can also like approach mental health services directly. So, but to get some kind of help and preferably that the kid or young adult or youth or whatever is somehow motivated themselves. It sort of can be, it's a challenge sometimes to get the motivation also for adults. So if I have had patients being sent to me by their spouse, it's often not very successful if there's no motivation in the individual to work on the issue. And that's, of course, it can be complicated with young people sometimes on that. So like it can take some time to get into the position and figure out how to do it, how to get them to the right person and to motivate them for that and to take time for that. Can be actually, I think, a worthwhile investment rather than sort of say, okay, you come with me, I should talk to this GP tomorrow, to spend some time on working on it until the person himself, herself is sort of have some motivation for it. But then there's the issues of stigma, shame, all these friends, peers, what will they think, all these issues also that can come into play. But if you see someone who is struggling, clearly suffering, they're in pain, they're not functioning, and this goes on for weeks, and don't wait months and years to take action. If you see that this is going on for weeks, then start exploring what might be done in this situation.
To answer that, so Beyond Blue has a chat online. They have a number you can call, email, and forums, and they will then point to where you with that issue need to go or whatever that is. So there's a free number to call.
Yeah.
We've got time for maybe one more question before I think Torben needs to go get some sleep.
Do you sense that I need sleep now? Is it evident?
Yes, if anyone has like anything they'd like to speak now or forever hold on.
We're going to sing.
Happy birthday.
Yeah.
All right, let's do that.
Birthday to you.
Got 5 minutes.
Happy birthday to you.
Happy birthday, dear Torben. Happy birthday to you. Hooray! Hooray! Hooray!
How old are you?
thank you very much. I like last night I realized actually that like I'm born like 2:16 a.m. in the morning. So I realized that on American time it's actually on the 25th at 8:16 p.m. I'm born. So actually this is I'm already into my first full, like a second full day. as however old I am. So, but thank you very much.
On behalf of everyone here, we just want to thank you for sharing some really valuable insights with us. And these sessions will be recorded, so if you ever want to look back on them, we'll make those available. Yeah, thank you for sharing your time, sharing your insights, and staying up till almost midnight. Yeah, it's just, I know it's an effort. So thank you so much, Torben. Thank you. All right.
Have a good day too. Bye-bye.